mu sɛ saa clot no bi form ɛwɔ your brain mu a, it can cause a stroke, and a frequent infections so no may occur as well. And these symptoms can start at an early age, so from 6 months and up. And the interest sickle cell disease and the spleen. In my last slide, and I was talking about the risk of infection. In the we have an organ called the spleen. The size of our fist, behind our rib cage on the left side. Spleen no it produces white blood cells. White blood cells and so they are very important in fighting infection. Spleen also filter old red blood cells. Cells na after 3 months, in a patient without sickle cell, and after 20 days in a patient with sickle cell, spleen filter get rid of those dead red blood cells. And as story red blood cells and platelets. That's the normal function of the spleen. However, in patient with sickle cell disease, intinina leaded to the spleen, any intinina what inside the spleen, because of the sickled red blood cells, it to me form a clot, honso sa. Into blood, into me flow in and out of the spleen as it's supposed to. Into ube blood, build it up in the spleen. Na spleen, kese, kese. Into yeshwe hana. Picture no say spleen attract the rib cage because it's enlarged. It's supposed to be behind the rib cage, but because blood I build it up so much my spleen big, it's not functioning how it's supposed to. Into spleen we call it splenic sequestration. The blood cells are stuck and it's causing an enlargement and a buildup in the spleen. In Tiabanesana, the treatment is to give fluids. So via a drip. Because, like I said, the red blood cells, are very sticky. And you increase the fluids in your body now. Hopefully, a bit to me, I'll loosen up the clot a little bit. You best answer my blood transfusion. Because the red blood cells are stuck in the spleen, the rest of the body are shorted. There's an imbalance of red blood cells. Blood transfusion to feed the rest of your body and also supply extra oxygen to the spleen to help the spleen to relax and hopefully open up the vessels more. Senebea clot a bit to me are dissolving that blood to me are flowing in and out freely. Antibiotics. The spleen major function is immune protection or producing white blood cells. If your spleen is not working, you're more at risk of getting an infection. So we have to give you antibiotics to prevent an infection from occurring. So splenic sequestration, it can happen quite often in some people. Some people might just get it once or twice. Some people it occur more often, and occurring more often causing more problems. Until sometimes doctors know how many patient and then they can say this your spleen is causing too much problems. We have to remove it totally. And in that case, on surgery, remove a spleen from the body. And because the spleen is not part of the body anymore, and I say I remove a spleen, your immune function is gonna be very low. And in that case, nipa krona ya removing the spleen, so taking antibiotics every single day for the rest of their life as a preventative measure, because organ a boa with immune system year free hot. Into every single day onom antibiotics to give yourself a form of protection, which is also not 100% guaranteed. In sickle cell patients, one of the major issues is pain. Baby, I work at a children's hospital. When the kids come, the major issue is pain. And the sickle cell patient or what pain, we call it a crisis or a pain crisis. There were different types of crises, but today I'm just going to talk about the vaso-occlusive crisis. Crisis, episodes of severe pain. Sickle cells, how I previously mentioned, are blocking some vessels somewhere in the body. Blood, into me and flow how it's supposed to. Tissues, the oxygen they are supposed to get. So there's major pain going on. Pain also to me lasted from minutes to days. And the severity no so no vary. There can be mild to moderate pain, and no, you can try to solve it with buying over-the-counter medication like Tylenol or Advil. But there's also pain that requires an emergency department visit where you have to call 911 or bring the child to the hospital for us to help the child with intravenous pain control. And to start pain crisis, a trigger. It can be dehydration. Hydration in sickle cell patients are very, very important because cells no are very sticky. So they need a lot of hydration. Sene sticky cells no bit to me are flowing a little bit better. Stress and so it to me a trigger pain crisis. Extreme temperatures, very cold environment, very hot environment, it to me a trigger pain crisis. Infections, it to me a trigger pain crisis. And a strenuous physical exercise and so it to me a trigger sickle cell pain crisis. And to sickle cell, what causes it in the first place? What causes sickle cell disease in the first place? And the sickle cell disease is genetic. Yeah, and that's the only way you can get sickle cell disease. But what causes sickle cell? How I said, or like I said in the beginning of the presentation, your body is made up of cells. Every cell has a time to live and a time to die. Nti cell no bewu a, ɛsɛ ɔka kyerɛ nkyirima no sɛ meekwe monye A, B, C, D. Sɛnea ɛbɛyɛ a mobɛ function the same way as I did to help the body run how God intended it to run. But because of certain mutations, which we're going to learn about, that information no are becoming distorted. So, for example, yɛmfa say a red blood cell no, the information is supposed to say pro-glu-glu. So, if you're normal cell, yeah, it's made up of molecules called pro-glu-glu. Into cell no wa cell na ebe replace the dying cell no. It's supposed to pick up the same information to do the same work. But because of something that interrupts that communication no, na ama cell na dane bibi foforo. Nti the information from the normal cell to the second cell are interrupted. It can be through the chemical area, it can be through as a result of radiation, some kind of infectious agent. Nti na I translate information in a different way. Nti instead send middle one no. Ahano ye glue no na hana dane val. Nti into me enye red blood cell and function how it's supposed to function because it has picked up the wrong information. Nti mumye share how it's passed down. I know, Sir Ghana, we're more familiar with the terms AS and SS. If you're SS, it means you have sickle cell disease. AS means only a carrier of sickle cell disease. It doesn't mean you have sickle cell disease, you're only a carrier. Inti say AS form no ewo. There is a 25% chance to say the child will not have sickle cell and there will also not be a carrier. Into your picture now, the blue side no standema sickle cell disease. So they're both carriers only. Into out of 4 children, you have 25% chance that you have a kid with no sickle cell disease and with no sickle cell trait. And you have 50% chance that the children will be born with sickle cell trait. Almost sickle cell, but they have the trait like their parents. And then you have 25% chance that you have a child with full-blown sickle cell disease. Parents know any sickle cell disease, almost your carriers only. But there's a 25% chance to say their child will have full-blown sickle cell disease. The same thing now, illustrated in this diagram. Carrier and carrier, 25% chance, no sickle cell disease, no carrier. 50% chance you have a child with the sickle cell carrier, and 25% chance that the child will have full-blown sickle cell disease. Into share trait, no, very quickly. Sickle cell trait, no, means that you have one of the sickle cell um, genes. To have sickle cell, no, you have to have two. But as a carrier or the trait, you only have one, meaning say you only have that you're only a carrier. If you are a carrier and so you live a normal life. Typically, you are the same as would be our only carrier, not at all. But sometimes, no extreme conditions, it to me trigger some of the symptoms that we already discussed. Okay. But it's very, very rare. So the main takeaway is if you are a carrier of sickle cell, only have one gene, meaning say you only have the trait, you can live a normal life the same way as will be our only sickle cell trait at all. But in rare occasions, you can experience some of the symptoms that sickle cell disease patients have, but very, very rarely. And how is sickle cell diagnosed? So during pregnancy, there are certain tests that can be performed to identify if the child has sickle cell or not. One of them is called amniocentesis. Said during pregnancy, there is fluid around the baby. Nti deɛ ɔmo yɛ ne sɛ ɔmo twe fluid no bi during the pregnancy phase no na makɔ test it wɔ lab and they can identify whether the child has sickle cell or is a carrier. Another test, and so yeah, chorionic villus sampling. And no, take a sample of the placenta, take it to the lab, and they can also check to see if the child has sickle cell, is a carrier, or has no sickle cell genes at all. After birth, and so no, there's another test that is performed. Yeah, your friend a heel prick. Maybe some of you who've had children will remember that our kids have this heel prick test done 24 to 48 hours after birth. It's tested for 30 health conditions, including sickle cell disease. I know they do it early so that they can intervene early as well. And why am I talking lengthily about sickle cell disease, especially to an audience like ourselves? According to statistics, 100,000 people are affected by sickle cell disease in the US. And out of this number, over 90% are Black African Americans. So this disease is ours, basically. Sickle cell disease and so no, it reduces life expectancy by 20 years. One out of every 365 births will be a child born with sickle cell disease. And now 1 out of 13 births will give birth to a child who has sickle cell trait. So it's very common and very important for us to discuss this. This map, the prevalence of sickle cell disease. So as you can see, it's Africa. Into the orange parts, it depicted where sickle cell is very prevalent. And I say, maybe a sickle cell, very, very common. Tiesha, West Africa, East, South, Okakra, Middle, Central to South Africa. Sickle cell disease is very, very prevalent. Nti sickle cell disease, yeah, they were and if you give birth to a child with sickle cell disease, what are the management and treatment options? So we have supportive care. Supportive care means that it's not curative, yin to me and cure, but we're trying to manage the symptoms of the sickle cell disease. So bakone blood transfusions. Sickle cell patients, because red blood cells die so quickly, the blood supply is always low. They're always anemic. Inti, what we do is when they come to the hospital, you better check it, your blood count, hemoglobin count. And based on that, we'll determine whether we need to give you a blood transfusion or not to help boost the oxygen amount, to help boost the blood supply in your body. Sansuma antibiotics. Like I said, spleen it's an overdrive. Sometimes it's blocked. Some of the patients are mobile. They don't even have a spleen at all. And their immune function is so low. So we have to ensure that we give them antibiotics to prevent infections from developing. This is one patient blood transfusion bag, ekutana. This is the amount of blood they're going to transfuse into her. She's visiting the hospital with a pain crisis, and they found that her hemoglobin is very low and she needs a blood transfusion. Other management and treatment options are disease modifying agents. And these are the three most common medications that sickle cell patients and one is hydroxyurea. No, it reduces the sickling of the red blood cells. No, so it tries to increase the surface area. Amy said instead of the sickle cell shaped cell, no, it should be nice and round. And yet, like a normal or a person without sickle cell idea, but it's aiming to be as round as possible and more flexible. Senebeya and forming many clots. And I wore L-glutamine and only reduce damage to red blood cells. And I wore crizanlizumab and also it reduces the stickiness of the red blood cells, meaning that there's a lesser chance of forming clots, lesser chance of producing pain crises, lesser chance of getting strokes. Management and treatment options, slide 3. And I will curative intent. I highlighted the intent because sometimes the intention is to cure sickle cell disease, but it doesn't always work. Tina ma highlighted intent. No. So one of the curative treatments is a bone marrow transplant. Bone marrow, no, is the inside of our bones. Red blood cells are produced there, white blood cells are produced there, platelets are produced in that same place. Into the aim, no ne say, say our bone marrow is a warehouse. Instructions now it produces wrong red blood cells. So we have to close down the whole factory and build it new. So what they do is the chemotherapy, it destroy all your bone marrow, and then they try to infuse healthy bone marrows to hopefully start producing normal cells. Until they're destroying the whole factory and building it from scratch with correct information to produce the right red blood cells. That's one of the treatment options. And another one is gene therapy. As I mentioned, sickle cell disease is inherited. So gene therapy aims to either fix gene produce another gene emma wrong information for red blood cells to be sickled, on between remove that part of the gene. Now the new one. But that's a whole different topic on its own. I just wanted you to know that there's bone marrow transplant option and there's gene therapy option. I think most people go with the bone marrow transplant, no. And you say wow on bone marrow transplant. They will check to see the healthy red blood cells are normal extracted. Then you get chemotherapy, they wipe everything out, and then the healthy red blood cells, your own healthy red blood cells, now massa instill in your own body, and hopefully it will pick up and produce the right thing. Sometimes they can use the bone marrow from a sibling or a family member. Need dear and match it with yours. Now you go through chemotherapy to wipe out everything that you have initially. Now the new one, and then hopefully your body will pick it up and then produce the right red blood cells to function how it's supposed to. I just wanted to show this picture to highlight what bone marrow is. You share this food, yeah. We see the different types of bones is inside the bone. That's the bone marrow. Yeah. I know says some people more pepper. Okay, what's the outlook and prognosis? Patients with sickle cell disease, I'm not going to lie to you, it's one of the most difficult experiences I have every time I go to work. And unfortunately, every single day, patients come to our department with sickle cell pain crises. And it's so tough to watch because the pain that the child is going through, the pain that the parents are going through from watching their children go through this, no, yeah, terrible, very terrible. And, it's nothing to play with. pain, no, it's not constant. It comes and goes. Some people have less pain crises. Some people, it happens more frequently. I think just yesterday, the last time I saw the patient was in June. That was her last pain crisis. And yesterday she came to the department again with another one. And according to the mom, no, it's been pretty good. Just in a span of a couple of months, no, because usually she has it more frequently. Low school attendance because of the pain and how it impacts your physical, mental, and emotional well-being. No, a lot of the children miss a lot of school, meaning said they'll be behind on their schoolwork. They need extra classes affecting their mental health, emotional well-being, and so on. And as a parent of a child with sickle cell disease, no, you should really know your child's symptoms. Also, who say, okay, or yeah, usually we can deal with it by giving Tylenol or Advil or say yeah, okay, maybe Tylenol and Advil or say yeah. That means that it's more severe. It's time to take the child to the emergency department or call 911. Into you as a parent, no, it's a or learning about your child's symptoms to know how to deal with them in a timely manner. How to care for a child with sickle cell disease. Again, it's all trusting what your child is telling you because they know their body themselves. You as a parent, we can empathize, but you to me feel it, the pain akora no efemu no nti de obeka no ese o take it the word and then deal with it according to what the child is telling you. Fluid intake. Kids with sickle cell disease need to drink a lot of fluid because cells, no, you're very sticky, very prone to forming clots, very prone to causing so many issues. So they have to drink a lot of fluids to keep well hydrated. Also, learning the child's triggers as well. I previously mentioned that heat can trigger the pain crisis, cold can trigger pain crisis, stress, injuries, and the list is endless. So you have to know yourself. If you are the patient with sickle cell, or if you have a child with sickle cell disease, you have to know their triggers. Ubituma, you say over-the-counter medication, Tylenol or Advil, you have to discuss with your provider. As I previously mentioned, no, medications no be what interactions with other medications into anything that a child with sickle cell takes, any medication, you have to talk to your provider and make sure that there's no interaction with other medications to cause further problems. And then as a new parent with sickle cell disease or a new parent with a child with sickle cell disease, a cell provider discussing serious symptoms to look out for, signs of a stroke, signs of increased spleen we're talking about. ESA as a parent will teach you how to feel for the spleen, where to feel, how you will know say it's increased or enlarged. All these things you will go through with your provider. And then if the symptoms are severe, of course, we'll be 911. How to manage sickle cell disease. Attend all appointments. Any appointment that you're given by your doctor, by the hematology team, we are doctors who specialize in blood, Esawoko. With us, sometimes though, when we are feeling well, we just feel like we don't need to attend appointments because I'm feeling okay. But all appointments should be attended. Identify the best ways to prevent infections with teenagers. No, at my hospital, no, yeah, they're difficult because I'm all and comply with taking the antibiotics. They're teenagers, they want to spend time with their friends. Now, every day they have to take medications, they have to dress in a certain way, not to be too cold, not to be too hot. And we get a lot of teenagers with pain crisis because more adhere to the schedule of taking the antibiotics every day or the other medications wasa or mufa. So it's very important to adhere to or stick to what the doctor has ordered or prescribed. Keep physically active within moderation. Of course, we know smoking and vaping totally out of the question. Medication interactions and contradictions already mentioned. And then talk to your provider if pregnant or planning to get pregnant, and care for your mental health as well. Life expectancy. So normal life expectancy, according to the Bible, 70, but the research is saying 79.3 for women and for men, 73.5. Patients with sickle cell disease, their life expectancy is 20 years less, so in their 50s, early 50s to mid 50s, that is their life expectancy, unfortunately. And see, why am I talking about all of this? As a nurse at this children's hospital, I see how this is impacting families every day. And one thing we always discuss is actually avoidable. It's avoidable, preventable too, and avoidable. How, you will ask? During the early days of courting and dating, so mami for more so, if there are any young people on the line, pastors, elders, anybody, ensure that this question is part of your getting to know the other person process. Do you want children? And if you do, what is your sickle cell status? And it's important to do this early before you get all loved up. Where you get to the stage, you can't be virtual, you're not gonna hear anymore because you're so in love. Okay, so it's so important to ask this question early. Do you want children? And what is your sickle cell status? And then to the pastors and elders as well. I remember back in the day, yeah, marriage counseling and couple counseling. They used to include all these questions in there, but these days I don't really hear people asking about sickle cell status during marriage counseling or during courtship and so on. So it's also an appeal to the elders, to pastors to re-invite this topic during couples counseling, marriage counseling, or even any programs involving young people who are not married, single people, to always ask this question and find out what their own status is and what the status is of the potential partner to prevent children facing this very debilitating disease for the rest of their life. So you're lucky, a bone marrow transplant will work for you and you can live a relatively healthy life, but there's no guarantee that the sickle cell red blood cells will come back again. Otherwise, you'll be on medications for the rest of your life. As a parent, it's multiple hospital visits, emotionally draining, mentally draining. It's a lot. So what we can do as individuals, to spare ourselves and our future children, if possible. So that's it. Thank you very much.
Amen.
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 Amen. Sir Jocelyn, there was edition of the my enumerator. I say, Sir, as soon as I see your America quarantine, so be what question and answer and more obituary Ediaba.
Eu sou tratando assim bicafra. E para tomar sempre sabe se me ya kwada nyina no. Yare sa se mo 76. Ba yare sa de bia na mo tutu me. Enti me pese busa se ano eh ne funa ma bi na bo me ana se de yan. Sa funa ma bi na bo me. Me pa to mote.
Yeah, and this is
Me busa question me say me ya kwada nyina kitikiti na ma yare sa na mo tutu me enye papa ba yare sa ti edebi me ko me doctor na o se ye ben de say insure to ama me nenam asem o ka kire me no nti ba yare sa na mpese mbusa se sa seti se no eno hu frama bi na bo me ana se de ka me yenye bi mo a
By now, at this age, Dianka, was sickle cell disease, and I'm sure that you would know by now.
Minim hu baba no ne mama ne papa ya ka bi ya kire ya duro ne man be wuzi mo be na nam no bi ko de piada oh that's a problem.
Yeah, if you feel said, Doctor, now in the Kasai, if the advice that he gave you is not really helping you out. You can always seek a second opinion, but in terms of our presentation, dear, at this age, the Nkao was sickle cell disease, and you would know. You would definitely know. Oh, okay. Nyame nenim. Nyame adom ti oda so take no sickle cell.
Because you almost say, me can't say, who by mama say, and I'm say, me different more fast than my young head, and I'm a cousin, and you there, sir. If you are not me, if you are not more talking, it's the best, sir. I'm the million. That's it.
Yo, Mama Josie, yeah, that's a pa. Mama start on a very light note. In your presentation about pain management, you talked about indubitable fact. You mentioned Tylenol. Now, no point in there. Say Trump is there, Tylenol, because Trump is on Tylenol crowd. Secondly, on a more serious, what about CRISPR gene therapy treatment? It looks as if it's getting a lot of good results. I know of a couple there in Atlanta, one number could paying had to undergo them gene therapy. That was maybe about 2 years ago. The last time I moved 3 months ago, was Ghana. No moved na a easy way change the easier known to me na CCO and I was actually following the whole process all through and sana with the chemotherapy. Now, in fact, Okada Hospital for a long time through the chemotherapy now to start with and sana. Will undergo gene therapy. In our say so far, new reviews now are very positive, very healthy. Mamu who so there or very healthy compared to what she used to be and all those things. Into damn CRISPR therapy, how well is it going? Apart from that, this individual, I think about 4 or 5 years ago, there was a 60-minute presentation via focus on that CRISPR gene therapy. In fact, there's some girl via, I think she was of a Haitian background that undergo them processing, and she had come out very healthy. And all those things. How does it go with you as far as this therapy is concerned? That's it.
Okay, Uncle Medase, as you've testified, there are a lot of good reviews about the gene therapy, I think they found bone marrow transplant, sometimes there's also a high likelihood that it was failing. Gene therapy, is relatively new, and it's based on the discussion you will have with your provider. Or no, be discuss which route to take. Should we go the bone marrow transplant route or the gene therapy? I mean, gene therapy, makes sense. Your building blocks, our cells, everything is made up of genes. Genes provided all the information on how our body should run. And to me, identify the area of the gene cause the sickled red blood cells. Now you to me, free now you replace it with a good one. It just makes sense that it's going to cause good results. So all I can say is it's effective. It works with some, it doesn't work with others. So the best thing is to talk with your doctor and decide which path to take. Yeah.
Thank you.
Jo, yeah, that's a bebre. Nyamin show. Pamacho bibi kakra na me pese me kan se minim couple bi a saa time na be ma ne kwa kofa ne yire afi Ghana. Aba doctor ne ka chen so mu nyina ye AS ntin ke betumi a enka be ma no na omo ware ye wontwa so bema na nti okofo oba ne bai omo wareye omo wutu enkwala ni nyina yibia and in the end na ware ne kran so agu so pamacho sometimes to say Josephine kind mumi ntumi educate ye mani ye pa sometimes your own self I don't know ye dwe enkwan oh me dono odo ni nti na in the end no results be say bana akwala no will be stuck to you forever. It's like time beyond wow mama ne kra parents ne kra no mo ntomo nti sometimes ya mumi enjai na me dono yatna che much not che how long kra na say ye hu bibi say ni advice ya I was it me tie nti mumi ntumi educate ye man ni youth no mo ba ne say ni jo kan no mo start kra courtship na mo akọ no mo akọ check na mo ashansa nti jo ye da sinya me shra
Yo, pacho me sawo so kakra. Ohima mi hu sene me address o because mi hu title said doctor or said nurse o but ye di kan no. Onyankopon hira pa ne onim de. Me ka say adesua de. Di se wawu. Me ka say mi so na ne esua biology kakra no kolebu o. Ye de ko sickle cell department bi nana ye nim de ne say ye se wo mo no omo nyi no 22 years. But and now chire yi ama ye hu say e bitimi nyi and especially ye party ya be pie de treatments no eboa nipa ni bebre. Na me question party true ne sa know your status no. Woka ya sister bi so asimoke na no. Me da se pa because na ye me problem kese. Enti me da se say obi so aka afo so say ye ma ye ninko ho. Nyame hira o. Amen.
Amen.
Me pacho me pese me so me kan kakra de hye ye hinkran. So ne sister Joe akire ye mu no. Me wo me sister pani bi ye. O ba kope na akola na sickle cells. O bi. Enti so uhu obo a uhu omo future no pepe o problem. Na ni nyina da bia but otimi ko school ko poly ewie no 26 e no worry. O worry ye no like omutu ne fo awo mo omutu ne fo na yare ne eba omu ano yare no omo asori no ko hospital ni admit no enti o worry ye no otimi wo ba ko at the age of 26 no enti 27th no o just akwa no kra nwia e no sanyemye you know what onyemye ne sa hodi ni ho the blood is so low enti o the hospital sa no timi wo ye na wansori bi owu yemu enti ya no kwasem pasta sa ya rewe ano adi enti ya advice ye ma no sane ye kan na pastors na counselors nso no they say omutimi cancel nkwala no about and I said my omadu ompani so about this circles of and I want to know sa mi sa bisa antiness ni say me pacho na obi wo na akwala no wo asram yesi asram just you nim say bill lobby no a wo kan ho asem say e liver na e produce na getting rid of the red blood cells assay no e then na maame no oni sickle cells but obewo no na ne ba na nya asram na ni ne hunam nyina ye yellowish e then na e basta me da say
Oh, well,
Sorry, what's asram? I don't know what that is. Like,
I think it's jaundice.
join this
oh.
baby join this no omoanya join this from the straight from birth no
Okay, we have lots of babies who have jaundice from birth. Your hospital is say we have kids who come in with jaundice. Sometimes it's just a genetic defect during whilst the baby is in the mother's womb, but it doesn't mean cell or sickle cell. A baby with no sickle cell trait or sickle cell disease can have jaundice. It just means that the liver is not functioning well at birth. Inti ese ye boa liver no kakra na itmi edi ejumadia is supposed to do. So what we usually do is we have a lot of babies who come to our department with jaundice. Inti jaundice no we deal with it with light therapy. Because Billy Rubin, like I mentioned, no, adults on our body no more. Inti UV light, yeah, the light, very bright light, is see babies no so they go in the incubator with very bright light. If the light no, it break it down the bilirubin. Say yeah, a bit me, I'll get less in the bloodstream. Into yeah, light therapy for a couple of hours na ya sa tested blood na to see how much bilirubin is in there. Say a decrease, yeah, fine. You can go home. It will go on its own. If the bilirubin level is still high, you will be admitted and then they'll continue with the light therapy. Until sometimes it's just a different case. And yes, sickle cell related at all. It's just that your liver at birth is not functioning how it's supposed to function. So we need to give a bit of help to help the liver to function how it's supposed to. So two different things, both bilirubin, but different diagnoses. Yeah.
Okay, thank you so much.
Your sister, but maybe so one question. It looks as a presentation. You didn't talk about any dietary considerations. Obutum, one of sickle cells and some relief, especially in times of crisis, because I know that there's some research will talk about the cassava products. Somehow it helps relieve you of a lot of these crises. I know of a boy, he's now a man in North Carolina. When he was a kid in Liberia, he experienced a frequent crisis. And at one stage, he be at the Catholic hospital, none or nurse one or recommended the wine to cassava products, and you'll be surprised how this cassava, this thing, eating a gari and boiled cassava changed his life. And somebody who initially had been placed within that 22-year range, I think he's now about 44 or something like that, and all those things. Is now much healthier than his youthful days. And so, and I've read about this research or talk about cassava products helping one of war sickle cells crisis in able to research, and now you make reference to them research as now maybe it could help us dietary medicine.
Yeah, Uncle Medase, you're right. Diet has big influence on every disease that you can mention in this life. So you're right. I didn't mention it. And cassava, dear, no, to be honest, minte, but I'm interested now. May I research about it to find out more information. But the main thing is fluid intake, hydration, because cells now are so sticky. Yeah, not clumpy together. Yeah, not clumpy together. So lots of water is very important, and then iron-rich food to give you the ahoɔden in the blood that you need. So kale, spinach, those kind of leafy greens will definitely help as well. But Medase, I'll look into the cassava thing.
Yo, send your menu up in the car. Yana cassava leaves, no, so what research power because my trend Liberia that now a main stable idea on the S2 cassava leaves. That's it.
Acha, with me, bisa question.
Pachai.
Me that's it. Acha, my question is now if I say omo blood cells na ya na stick it together in the baby a clot na flow no entimi nko yie no. Ebisa so for no omo betimi engage in regular exercise abeboa omo with blood flow and that's
Okay, so exercise recommended for every person to help with blood flow. But patients with sickle cells, now yeah, the restriction to physical exercise. No? Because remember, when you do exercise, you sweat, you lose fluid, meaning you're more prone to become dehydrated. Or your exercise also so your blood vessels constrict. If you're not exercising, your blood vessels will be bigger, or exercising, or they'll constrict, meaning your sickled red blood cells will have a harder time of passing through the vessels, causing a more likelihood for it to clot. Exercise, we have to moderate it. I want to mean extreme exercise, and also they shouldn't not do any exercise at all. Any patient with sickle cell disease has to talk to the doctor to identify exercise and causing me problems with my sickle cell disease. Yeah. I hope so I answered the question.
Na mpacho medical crestals next gen Joe the no so no. We say sickle cells na it deal with blood. Na blood no sumu na oxygen efa. Until when you doing the exercise more no, now oxygen no so low ninti na until no more advice say you can do more exercise to say regular people no. Because oxygen already no low. Until we na fe hume no wow, papa, but who mean 10 more than what you supposed to. And don't hear who that's a sunny nest akana a bebuama who the limiter with me exercise do because say anybody say or yet me like yeah 30 minutes a day. To be a neighbor do you call doctor who bit me I say be a 10 minutes or 5 minutes walk be to a busy bit me no be watch say wado pebe na fi ama home no so oxygen ye low nti home so ho be chiro e wo ho me da se.
Any other questions?
Yo, see the hair side, dear. Yes, a bibia, ako kama, Sister Jocelyn, there was a big brain, I mean, show. So we name D, only and so your barbeche, near to be between I share with others. Now, it does it that your codon so as to be brave. So, down dial or ba, every stream your program in mind. There are 2 Queens districts, your line is so. It is a one my son term, and I may be anti me and my swat. Yen share no more soon to me and conquetti no more knowledge and so yen ebi. And to and son, ye be free hano. Your best threat, sister, ya no bompaye, Eddie, Sister Johnson, ashing a mensa a mine. Say, Bemana, and in dear a brandy breviano. Obey me, Abba and chain, any ababishe. Near so the asheva didn't sat now, tree be sim any monster. Or more hobine and next week, yes, I be shame more than I say,
Chaume ya mompae. Yana jawo so yada wase. Akwenya odi amaya de boye for saying. Yada wase sabri biara won hwehwe mayen. Se yensuinsu ni omebeboa na tintin ya pomuden ho asem. Yada wase ye nuaba wo fa no so ede nsem se bae ho. Erade nim se kokobo enka nsem na de bae nti ye sel se mi entie gu akoma pamu. Na face de yesuan yentimi enka binche afofro. Yesel se ma unsua no enkoswara engunu so. No ntimi nche ye ndi hia ema ye nipadua yi. Ye doni na busua nyina hye wonsa. Erade yenso na wotwimu ye bewram ye nimu asem. Ye de ho nyina hye wonsa. De yesel no se boye ho ban ye de fini efibe mu ye ne emusua. Ye dwuma mu call ye school call ye fitna mu nyina ye de hye wonsa. Yesel se koswara na hwe so na boye ho ban. Na mayen ahoden ene apomden a yebetimi ede atena asene asomwo. Yeda wasesa wodo yenti bring na no mayen sema ehia yen na ekaka yen na etuemfo. Yeda wasena enwuma adesua yesu so se me yentena ye ho. Se de yebusa no ewo Yesu din mu nti. Amen.
Amen.
Pray anytime. Pray when you're sad. Pray when you're glad. Pray when you're weak. Pray when you're strong. Just pray and pray. 'Cause anytime is prayer time. Pray anytime. Pray when you're sad. Pray when you're glad. Pray when you're weak. Pray when you're strong. Just pray and pray, 'cause anytime is prayer time. Ooh. The offices in heaven, they're opened up for you every second.